Good afternoon, everyone, and I want to welcome you to this week's Strategies for Healthy Living workshop. Today, I want to switch it up a little bit, and I want to introduce to you my five-part series. It's an educational master series on the 5 secrets to the importance of joint health. And today starts the first secret. So I will tell you this secret at the end of the presentation. And also, I'm gonna wait about a minute or so to let everybody log on. If you have any questions as I'm going through this, please feel free to ask at any time, and I will be sure to address those questions. If you are unable to see my screen, please let me know. Okay, so we're going to go ahead and get started. So the reason why I wanted to do this first secret and share this secret with you is because we all know that we're supposed to take care of our joints, right? We know to take care of our joints so that we are able to move and we are able to be flexible. And if our joints aren't functioning correctly, then of course we're going to be in pain, or we're going to be limited in our activities of daily living. So the one thing that I want to be able to do for you today is not only just tell you, hey, take care of your joints, but I want to give you some value as to why you should take care of your joints. If you know why it's important, first of all, to take care of your joints, then you'll be more inclined to take care of your joints. Okay, so today we're going to talk about secret number 1. And the first thing I want to talk about in relation to joints is tell you about joints. What do you think about when you think about the joints in your body? Besides that they may be sore and hurting today, um, I want to be able to explain to you the anatomy of a joint and how wonderfully intricate it is, how we are made with so much detail in our body, that our joints even have their own little network or system in each one in our body. There's hundreds of joints in our body. Each one has to be working properly in order for us to move properly. So what we're going to talk about is, what is a joint? What are the types of joints? What's the basic anatomy of a joint? And we're going to talk to you about a concept called Hilton's Law. And that's going to be an eye-opener for a lot of you, especially those of you who are under chiropractic care. It'll start to make some sense why different parts of the joint or incorporated into maybe some of the pain that you're having. Then we're going to talk about the different types of arthritises, and we're going to talk about how some of this presents clinically. And we're going to tie all of that in together so that you will understand this first secret to having the importance and understanding the importance of joint health. So I want to start our presentation today about a quote that I really like. It's our inspiration for our presentation today, okay? And this quote goes as this: "It doesn't matter how slow you go, as long as you don't stop." And this is so important because it's important for you to keep moving. The worst thing we can do is become sedentary. And during this time, we've all been tested and need to be encouraged to do a little bit more movement than what we're doing right now, like sitting on the couch, laying on the couch, watching Netflix all weekend, okay? So you got to keep your body moving and stay healthy. So I want to talk about what is a joint. Okay, so some of this, bear with me, I have to break it down because some of you, I'm sure, have not gone to school to learn anatomy. So I want to make sure that you get all the bits and pieces. So another name for a joint is an articulation. So if you hear the word articulation, they're talking about joints. People who study joints are arthrologists, and arthrology is the study of joints. The way that we classify joints is not only based on where it's located, but it's truly based on the structure of the joint and also the function of the joint. So you may be asking, what does that mean? So let's talk about this. Now, as we go through this, you're more than welcome to take notes, but I really want you to understand how detailed joints are and how detailed the anatomy is. So when we're talking about structural classification over here on the left side of the screen, there's three types of classification of joints based on how they're made, based on their structure. Then there's three classifications based on how they function. So let's talk about the structure. So some joints are called fibrous joints. Some are called cartilaginous joint and some are called synovial joints. This synovial joint is what we think of mostly in our brains when it comes to joints, okay? An example of fibrous joints are our teeth, and I'll show you in a second. Another example of a cartilaginous joint are our ribs, and synovial joints are the most common throughout our body. When we talk about functional classification, it has to do with the movement in the joint. So this is very easy, okay? So either they're gonna move, they're not gonna move at all. So they're a type of joint that does not move, or is the type of joint that allows for slight movability. And then there's joints that they're free to move, okay? So the most common joints that people have issues with are synovial, diarthrotic joints. Okay, so this is how they're classified. They're joints that are filled with fluid and they're joints that are freely movable. Basically, that's what that type of joint is. So let's talk about the fibrous joint. When you think of teeth, you don't think of joints, right? But there are joints. There are joints there because these teeth actually fit into your jaw, okay? So when you think about your wisdom teeth, for example, if you've had a bad wisdom tooth, it can move about into where it starts to infiltrate into your jaw, into your gum line in your jaw. It's very painful. So that is a type of, I'm gonna go back to, of a fibrous joint. Another example of a structural joint are the ones that's located in your rib cage. So if you've ever had inflammation here around your breastbone, that's usually inflammation in these type of joints. So your ribs wrap all the way around, okay? And they connect in the front to your breastbone by cartilage. That connection between the cartilage and the bone is where it can get inflamed. That's a cartilaginous joint. That's basically the bone attaches to cartilage. There's no space in between here or anything, no joint cavity, anything like that. So that's where you can also get costochondritis. Another example here of a cartilaginous joint, there's two. So basically in the front of your pelvis, this is your pelvis. In the pubic area, you have a joint called a pubic symphysis. This joint tends to get very inflamed, especially in pregnant women, okay? Also, you have a cartilaginous joint in your spine. So, for example, you have a bone here and a bone here. In between these two bones, you have cartilage. There's no joint space in between. It's just bone, cartilage, bone. That's a cartilaginous joint. So there's not a lot of cushion in between here besides the disc. That's why it's so important for you to take care of your spine and your discs. Never neglect your discs. And if you're a patient of mine, you know I always talk about keeping these discs healthy. So we're going to dive into talking about the most common type of joint. And the most common type of joint is your synovial joint. This is the one that people think of when they think of joints. So synovial joints, this is an example here, is made up of so many parts to it. So these synovial joints are most commonly found in the shoulders, the hips, the knees, okay? These are the joints that undergo so much weight bearing that they have to have all these supporting structures. So some of the supporting structures you see here on the picture, and I'm going to orient you to this picture. You have a bone and another bone, okay? In between the bones is where you have your synovial joint. You might be asking, what's a synovial? What is synovium? Okay, so the synovial joint has, and it's dictated by this purple here, okay, called a synovial membrane. That membrane inside the joint is what secretes synovial fluid. It's a lubricant. It's very viscous, and it's there as a protective function, not only for protection, but also you'll learn later its role in helping the cartilage as well. So you have an articular capsule. What that means is you have all these different layers to the joint. So you have a very tough fibrous layer on the outside of your joint. And not only that, but you have ligaments, you have muscles, tendons, okay? You have the cartilage on each end of the bone. Very, very intricate system that goes on here. So we're going to talk about some features of the synovial joints that are very important. And this will answer a lot of the questions you may have when you hear certain conditions. Okay, so the synovial joint is double layered. It's very protective. As we saw on the picture before, it has a very fibrous outer layer. Not only is it reinforced on the outside, but it's reinforced on the inside. There's an inner layer. And that inner layer is what produces synovial fluid. Okay, so it's doubly protected that way. You also have cartilage. We know cartilage is for cushion. So you have articular cartilage here. Its role is to reduce the friction during movement. It provides a cushion. But here's an important point. Articular cartilage is avascular. That means it does not have a blood supply. That means if it gets damaged, the chances of it healing is reduced significantly. So that's why cartilage is very delicate. Of course, you have a joint cavity, and then you have ligaments. So we've heard ligaments before. We've heard ligaments being sprained before, right? But ligaments have a supportive role as well. They're important in connecting bone to bone. And there's two types of ligaments in a synovial joint. You have extrinsic ligaments. Those are ligaments that are on the outside of the joint, and that helps reinforce the joint. Then you have intrinsic ligaments, and those ligaments are on the inside of a joint. And I'm going to show you what that means here. So here we have a picture of a knee. This is a front view of the knee. You have your femur, okay, and the knee is bent in this picture, right? So the patella has been removed, the kneecap has been removed. So you have your femur. You also have your tibia. These white structures on the outside, those are ligaments. So extrinsic ligaments are on the outside. The intrinsic ligaments are just what it says, on the inside. So this is an example of the ACL or PCL. So if you've ever torn your ACL, PCL, this is where it's located. So there's a lot of structural support in the joint. Here's some other features that are important. If you've ever heard of the word bursitis, there's a structure called bursa. Plural is bursae. Okay, these are little cushion sac-like structures that's also filled with synovial fluid. Now, synovial fluid comes from the plasma in your bones. And through a process, it goes through the synovial membrane and secretes out to where it's supposed to be in the synovial joint. But in bursa, these are little sacs that have cushion and fluid on the inside as well. So if you've had bursitis, it means that that fluid has been reduced for whatever reason, and now it's inflamed. Another structure you have in a joint are fat pads. Fat pads are a protective packaging material in the joint. So in some instances, fat is very important for you to have, okay? And in this situation, it is. These are fat pads. You do not want to lose these fat pads in the joint. And then we have tendon. Okay, you've heard of tendon. So ligaments connect bone to bone. Tendons connect muscle to bone. So you don't have to memorize that, but just know that, see how detailed and intricate all this is. So when I tell you to take care of your joints, you have to take care of every structure here that's located in a joint. So I put a picture of a knee here. This is a side view of the knee. So this is your femur, which is your big thigh bone. This is your tibia, which is your shin bone. Then you have your kneecap here. This muscle here is your quad. That's the thigh, the front thigh muscle. What I want you to see is that there's multiple bursa that are located in the knee. The bursa are dictated by the blue here, okay? Those blue sacs are supposed to have synovial fluid, just like the inside of the knee. So for example, if you've ever hit your knee hard on the floor and it hurts really bad, sometimes you either hurt the fat pad that's underneath the kneecap, or you have hurt this bursa. Some people ruptured that bursa, but that's a cushion on your knee. So it's like having knee pads, right? But it's part of your body. So the importance of synovial fluid, just as a synopsis, it's important for lubricating cartilage. It's important for nourishing the cartilage. So the cartilage doesn't have a blood supply, but it does get some nutrients from this synovial fluid that's inside the joint. It helps to remove waste from the cartilage cells. So the cells undergo a lot of metabolic activity in cartilage, and that waste is flushed away through synovial fluid as well. Synovial fluid is important for shock absorption, and it's also important in what's called the inflammation oxidative stress. Okay, so we're going to learn next week how inflammation plays a role in people getting arthritis or being prone to joint injury. So we're going to talk about a law called Hilton's Law. So Hilton's Law basically says this about a joint. Okay, so pay close attention. This is super important. So the nerves to the muscles. Okay, so nerves go to different parts of your body to every part of your body to tell every part what to do. Okay, and nerves also receive information, send information back to the brain to tell your brain what to do. So it's a two-way communication. So the nerves to the muscles acting on a joint give branches to that joint as well as to the skin over the area of action to these muscles. So basically the nerves that go to a joint to tell that joint what to do also branches out and tells the muscles what to do. It tells the skin as well what to do. So that comes in handy when you say, okay, well, Dr. Payne, is it the joint that's the problem, or is it the muscle? The answer to that is both. It's always both. Both are always involved. Okay, now we're going to go into this a whole lot more when we start to talk about our next secret. But I wanted to introduce this law to you so you know that all of it works together all the time. Okay. So when joints are formed in embryonic development, it starts in the 6th week of embryonic development. So it starts early. The nervous system is the first thing that's formed because the nervous system is going to tell everything what to do. But by the 6 week of development, joints start to form. You're going to have different cells that are going to become the different types of joints. They're going to start differentiating into the fibrous joints that we talked about, to the cartilaginous joints, to the synovial joints. It already knows where to go. The cells know where to go and migrate. Isn't that cool? We don't have to tell the baby how to form. Okay, now arthritis, we know is a huge problem in our country. And we also know that exercise helps to reduce problems with joints. The reason why is because exercise increases flow of synovial fluid to the cartilage and nourishes the cartilage. Exercise and joint health strengthens muscles and supports and stabilizes the joints. So as you're working out, you're strengthening all those structures that are around the joint that we just went over. Okay, in extreme exercise though, you can aggravate a joint. So there's always a sweet spot, right? Where it's safe to do something, but if you overdo it or put too much force, that's where you're gonna start having joint injury, okay? These are the 4 main types of arthritis. There's so many more, but these are the top 4. So arthritis in general, we know is basically we know it's joint, itis is inflammation. So inflammation of a joint, swelling, pain, and stiffness. If you've heard of gouty arthritis, that's gout. Okay, so if you have too much uric acid in the blood, it can result in gouty arthritis. And usually people that eat a lot of red meat, for example, can be more prone to this type of arthritis. Next, you have osteoarthritis. This is the most common. This is the one where you hear people say wear and tear of the joints. We're going to learn what that really means in this 5-part series. And then the last type of arthritis that's most common is rheumatoid arthritis. So that's an autoimmune disorder where your immune system turns on your joints and starts breaking down that synovial membrane that we saw earlier. So this is secret number 1 to the importance of joint health. Secret number 1 is to maintain the intricate joint structure and function. This is something that people do not talk about. Even though it's important for you to know to take care of your joints, if you don't understand how detailed a joint is, you don't know what you're taking care of. You just know to take some glucosamine and hope for the best. But if you have the knowledge and the education, and you know the different parts of a joint, then it makes more sense to you to what you're doing in order to improve your joint health. So this is secret number 1, okay? To maintain the intricate joint structure and function. So what we're gonna learn next week, and this is gonna be interesting. I can't wait to go over this one because you're gonna learn the relationship of joint health, you ready? And the immune system. Now, you might be saying, wow, that's a stretch, but I'm gonna tell you that that's a hint to secret number 2 to the importance of maintaining joint health. So I hope you guys enjoyed that today. If you have any questions after watching this presentation, shoot me a message below. And I will see you next week, same time, same place. And we're gonna go over secret number 2 to the importance of joint health. Thanks so much, and you guys have a good day.